Right guys, I'm happy to see you all. So guys, now we are going to talk about the important bias and we will be finishing this particular playlist of epidemiology, right? So in the epidemiology, if you guys remember, we have talked about the descriptive epidemiology, we have talked about the analytical epidemiology, we have talked about the experimental epidemiology in the last session only. And now I'm going to talk about the fourth one, that is your bias basically, okay? Bias basically, what are the different bias which you can see in different kind of studies, for example. And we'll talk about very important factor, that is the confounding factor, which is asked very frequently in your MCQs, right? So let's begin with the bias and its types. So let's go into it, right? So guys, over here in the bias basically, usually we say that this person is actually having a bias in the mind. Okay, for example, you were actually, you went to some examiner, okay, or you for example in your viva and all, okay, and usually we are complaining that, okay, to that person, right, the interview was very kind, the interviewer was very kind, right? The person who was taking the viva, the teacher who was taking the viva, he was having some bias, right? So usually we boys are saying that yes, that particular teacher was very kind to the girls, right? He was just asking very easy questions, and whenever we are going into the room, okay, and they are just bombarding us with very hard kind of questions, right, and very tough questions, right? That is, in that point of time we say that yes, this is, this particular teacher is having the bias in his or her mind, for an example. Okay, I'm just talking hypothetically, right? Fine. So in this case, this is the interviewer bias, right? So like that, we are having different kind of bias, right? For an example, here you can see some of the different bias. For example, here you can see sampling bias, you can see control selection bias, you can see attrition or the follow-up bias, right? Or you might see the observational bias, recall bias, reporting bias, confounding bias. Okay, so different kind of bias we are having. So you don't need to hit your mind over here in reading all the different kinds of bias. I will just talk about the most important kind of bias which have been asked in the frequent MCQs, right, in your past MCQs and all, and we'll try to make some concept in it, right? Okay, so starting with the bias, guys, again, right, errors. With that, I'm just starting it. So errors, what are the errors? What are the errors? Errors means you're doing some mistake, for an example, right? There are two kinds of errors, by the way. There are two kinds of errors. I'm talking about errors in epidemiology, right? Errors in epidemiology, because still we are in the topic of epidemiology. So errors in epidemiology, guys. So two types, okay, two types. One is your random error. One is your random error, right? Random error. For example, you did something by mistake. Okay, you did something by mistake. Okay, and you were not having any kind of intention for doing that. Another one was the is the basically systematic error. Okay, it is the systematic error. Okay, this is that kind of error. Usually if you are doing some kind of error, you don't want to repeat it. You don't want to repeat it. But okay, so usually if you are doing some random error, you will be actually avoiding it, right? But in the systematic error, the same error, if some person is doing again and again and again and again, okay, once, twice, thrice, okay, same kind of error, if it is repeating again and again, then this is the systematic error. Usually this is the systematic errors, okay. And here we are talking about bias. Here we are talking about bias. So here we are talking about bias. In the section of random error, we are talking about the sampling error. We are talking about the sampling error. So first question is covered already, guys. What is that first question? What is that first question? First question is, bias is covered under, is it under random error? No, it is under the systematic error. That is your first MCQ, guys, very important. So bias is coming under which kind of error? That is coming under the systematic error. That is coming under the systematic error. That is your first MCQ, right? Okay, moving further from here, what are the types of bias? Important types of bias, okay? Types of bias, right? Okay, guys, let's try to make it interesting as well, right? Fine. So types of bias, guys, as I have told you, several types of bias. Okay, a lot of information written over here. You don't need to remember that much information, right? Okay, so types of bias, guys, I'm gonna basically mention those kind of bias which have been asked in the past. However, there are many kind of bias, right? So only those kind of bias we are going to talk about. So basically we are actually starting with the first one is the Berksonian bias. Okay, Berksonian bias. Okay, so take your pen, take your notebook, okay, and be with me, guys. So Berksonian bias, what is it? Okay, first let me just try to make you understand Berksonian bias. Berksonian bias basically we are seeing in the hospital based cases. This is the hospital based case control study. First question, is it coming under which kind of study? Is it coming under cross sectional study? Is it coming under case control study, or is it coming under cohort study? Your answer will be it is coming under the case control. This is the hospital based case control study, right? So hospital based, this is the hospital based case control study. If the examiner wants to ask you the bias, right, and they have mentioned about the hospital in their MCQ, understand that they are actually indicating towards Berksonian bias. So this is the hospital based case control studies. Okay, hospital based case control studies. Fine, understood. Next point is that this is basically occurring due to different admission rate, differential admission rates. Okay, so occurs due to differential admission rates, differential admission rates, differential admission rates. Okay, so that is the bias. Okay, so which kind of bias is seen in the hospital related authorities or hospital related institutions? That will be the Berksonian bias. Be very clear with that. Okay, next point, how you can reduce it? It can be reduced by randomization. Again, can be reduced by randomization, can be reduced by randomization, or it can be reduced by matching as well, can be reduced by matching as well. Okay, you don't need to know the much details about that. So Berksonian bias, okay, that is the hospital related bias. Second bias, guys, second bias, that is the recall bias. Recall bias, okay, I'm recalling something, memory, I'm recalling from my memory. So this is the memory bias, also called as the memory bias. Which of the following is also called as the memory bias? That is the recall bias. Memory bias, here we are actually talking about, okay, it is studied under which kind of study? Is it case control? Is it cohort? Is it cross sectional? What kind of study you are talking about in the recall bias? That is the case control study. It is specifically studied under, specific to case control study. Believe me, guys, these are your MCQs, case control studies. Okay, next point, guys. Okay, recall bias, I'm recalling something, memory, from the memory, right? Okay, fine. Next one is, it is done in those kind of cases, done in those conditions, or it's done in those diseases who are having the higher mortality. So basically it is done in diseases with higher mortality. For example, rabies. Okay, rabies, once the patient is starting to getting the symptoms basically, okay, especially, then after that 100% mortality is there in the rabies, right? So even by listening to the word water, right, they will be having the tremendous response, right? So that is the thing, that is the recall bias. Okay, the studies which are actually we are doing for those diseases who are having the higher mortality, usually they are the recall or the memory bias. They're specific to the case control study. Okay, next bias, guys, next bias over here which I'm going to talk about, that is your attrition bias. Okay, attrition bias. In the attrition bias, what we're going to talk about, in the attrition bias, we are usually saying that it is specific to case control or cohort, or is it cross sectional? It is specific to cohort. Yes, it is specific to cohort study, guys. Okay, so usually they are actually trying to confuse you with these bias sometimes. Okay, they will be giving you the options case control, cohort, and the cross sectional. You need to actually able to make your decision over there, that is it cohort, is it case sectional, or is it case control, or is it cross sectional study, right? Okay, fine. Now next point over here which you need to understand, that it is also called as the follow-up bias, or you will be seeing that basically they will be having the poor prognosis as compared to those persons who have completed the study. What I'm saying is, cohort study was your which study? Case control study was your interview based study, and the cohort study is your cohort study, what I told you, it is your follow-up study. For example, there were some persons, cohort study means cause to effect study, prospective study, remember? Yeah, right? Yeah. So there are some persons who have just left from the study, right? So it is seen that those persons who have just lost to the follow-up, they will be having poor prognosis as compared to who have completed this study. This is actually read under the attrition bias. Okay, so loss to follow-up. In short, I'm just writing loss to follow-up study. Okay, it means that the persons who have just left the studies, they will be having poor prognosis as compared to the persons who have just completed the studies in the cohort 1, right? So loss to follow-up study, that is study under which bias? So attrition bias is an example of, this is an example of cohort study, right? If I will ask you, Berkson bias is an example of case control study. Recall bias is an example of case control study. Okay, very nice. Fourth question, guys. Fourth bias, I would say. Fourth bias, that is your Hawthorne bias. Yes, different name, guys, different name. Hawthorne bias. Okay, usually if you are reading some different name, okay, usually it is a tendency that we will be remembering it for a longer period of time. Usually, I don't know, but usually it happens. So Hawthorne bias, guys, this is basically change in attitude, right? This is basically change in attitude or change in behavior. Change in attitude or change in behavior of whom? Behavior of me? No, it is a behavior of subjects who are actually undergone the study, right? Behavior of subjects under observation, or behavior of persons who are under observation of the particular study. Subjects under observation. Okay, what are you talking about, man? I am saying that, for an example, the persons, I took the subjects, and in those persons I'm usually doing the study. Which study I'm doing? Basically, I'm doing the cohort study, I'm doing the follow-up study, I'm doing the present to future study, right? That is the study which I'm doing the prospective study over here. So those persons are having change in behavior, change in mind, let's say. Okay, I'm not gonna follow this study, for example. This is a change in mind, right? This is called as a Hawthorne bias. Hawthorne bias is seen in the cohort studies, right? Okay, basically this we are actually talking about in the cohort study. So it is specific to cohort study, right? So attrition rate we talked about in the cohort study. So attrition bias will be seen in the cohort study. Hawthorne bias seen in the cohort study. Berkson bias was seen in the hospital case studies. That was your case control study, right? There we were talking about the differential admission rates, right? Clear. Now fifth one, guys, okay, the last one. Okay, will not bother much about the types of bias. Okay, so the fifth one over here which we are going to talk about, that is the selection bias. Okay, that is the selection bias. Fine. In the selection bias, we are generally talking about the sampling bias. This is the sampling bias. Okay, MCQ, guys. Basically this is the sampling bias. Okay, this is the sampling bias. I told you what sampling errors are coming under random errors, right? Basically this is the sampling bias. Now this is basically the non-random allocation of subjects. Okay, we are not doing the randomization over here, we are doing the non-random. So non-random allocation is seen over here. Non-random allocation of subjects or people. Okay, basically subject, I mean the people, the persons which are actually going through the study, right? Okay, so how you can remove it? There is non-randomization. How you can remove it? Do the randomization. So can be removed by randomization. Basically can be removed by randomization. Okay, clear, guys? Yes, fine, good. Now let's talk about the next one. And that is the important factor over here, right? That is we are done with the bias, guys. Don't worry, we are done with the bias. Okay, and if you are talking about how you can treat bias, okay, before coming to the important confounding factor, let's talk about the bias only. Just finish it off. Okay, so what about the management of bias? What about the treatment of bias? What will you do to remove this bias? Simple question. Okay, I will do the blinding. Okay, I will do the blinding. Blinding means what? It means you can do basically the randomization. Randomization is the universal, guys. Randomization is a universal. If you don't know the answer over there for these kind of question, okay, and you are seeing the randomization in the option, go for it. Randomization is the universal treatment of all these things. So randomization, either you can do randomization, either you can do blinding. So over here my answer would be treatment of bias, that I can remove this. Okay, so bias can be treated by right, either randomization, either randomization or blinding, right? Either randomization or blinding. Simple. Now randomization, we have talked about that. Okay, go through the previous section, you will understand beautifully what is the randomization. But in this section, let's talk about the blinding as well. So what is blinding, guys? What is blinding? Okay, so let's understand what is blinding. Okay, what is blinding? Blinding, you know what? You will take some cloth and will just tie it over the eyes. Is it the blinding? No, I'm not talking about that blinding which you used to play in your childhood. I'm not talking about that blinding, that blinding, guys. I'm talking about this blinding. This is actually having three types. Okay, this is basically, we will not be having awareness about something, right? For an example, we will not this particular subject means, I hope that is basically the person I'm denoting to the subject. This subject, basically these are the subjects for me, that these particular persons are subjects for me, right? Now they will be actually undergoing some kind of study, right? So if these subjects are not knowing basically what kind of treatment they will be getting, right? Will they be getting placebo? Will they be getting some kind of drug? Okay, so this is called as the single blinding, or this is called as the single blind trial. For example, in the phases of clinical trials, we are not telling the patient that you are getting this kind of drug or you are getting the placebo, right? Usually what happens, if you will be telling them, okay, usually what happens, when you are working in the hospitals, right? Some patients are very having irritating kind of nature. Okay, however, I should not tell this, but some patients are like that. So they will be saying again and again, okay, sir, I'm having pain again and again. And okay, despite of you have given them NSAIDs, you have given them opioids. Okay, still they are saying that no, sir, I'm having pain. I'm not satisfied with your injections and all, right? Then usually in some cases, what we are doing, right? We are playing with the placebo effect, right? We will be saying the patient, yes, we are giving some drug, but usually we are just giving the 5 ml normal saline. For an example, you're giving the 5 ml normal saline, okay? And if the person is saying, yeah, now I'm feeling better, you gave some better drug to me now, okay? Did I give the better drug to the patient? No, I know that I played with the placebo effect. Placebo means that you are not giving the actual drug, rather you are just giving some simple thing. For example, 5 ml normal saline, you just injected into the vein of that patient. Now the patient is saying, now I am feeling much better. So what is this? This is just the placebo effect, right? So that I give you the example, right? So in the blinding, we are talking about three types basically. One is the single blinding, one is the double blind trials, and one is the triple blind trials. And most commonly, what kind of blind trials we are using? For example, in the phases of clinical trials of the drugs, that is your second blind trial, which is used very commonly, guys. So yes, guys, come on, we are talking about over here the types of the blinding. Okay, the types of the blinding. So what are the types of the blinding? Come on, guys. So first type I told you, that is the single blinding. I told you the single blind trials. Right? Next, I will be telling you the double blind trials. Okay, usually these are your MCQ. What is a single blind trial? What is a double blind trial? And next one is the triple blind trial. Okay, mind you, if they want to ask you the type of blinding, then most commonly, okay, most probably they will be asking about the double blind trial. Okay, so let's talk about the single blind trial, double blind trial, and the triple blind trial. In the single blind trial, guys, very important, listen to me very attentively. Single blind trial, in this case, we are actually, whatever the subjects are, or the participant or the group members, whatever you want to call it, okay, they are actually unaware of what I am giving to them. Is it I'm giving placebo to them? Is it I'm giving real drug to them? They are unaware of that thing. So either the participant or the group member or the subject, is unaware. Okay, I'm writing in the different thing. Either the participant or group member, okay, or subject is unaware or blind. Okay, this is called as the single blind trial. In the double blind trial, participant or the group member, okay, is unaware. With that, observer is also unaware. observer is also unaware, that is also called as your double blind trial. For example, you are having some patient, okay, you are having some patient and you are a doctor. Neither the patient knows what they are getting, nor you know what they are getting, okay, and I am the analyzer now, okay. I came to your hospital, okay, I asked for the permissions and all, okay. You are a doctor, these are your patient, okay. They don't know what I'm gonna give to them. You don't know what I'm going to give them, okay. So that what I'm doing, I'm removing this bias, okay, because if I will be telling you that you will be having bias, that you will already be knowing that what I'm giving to them, right? So to remove that bias, this is called as a double blinding bias, double blinding trial, to remove this particular bias. So neither the patient knows nor the doctor knows, okay. You are the doctor, nor you know, neither you know the what drug I'm gonna give them, nor the patient knows what drug I'm gonna give them. Only I know what I'm giving, right? That is called as a double blinding trial. Okay, fine. Now, what is the triple blind trial? Yes, you are answering me already. Yes, participant or the group member, is unaware. Okay, he is unaware. Yes, I agree. Plus, with that, doctor, for example, you are a doctor, you are also unaware, or I would say observer, you are an observer or doctor, observer, he is also unaware. With that, now I also don't know what I'm giving, right? I just took whatever I got from the government side, or whatever I got from any kind of company, or from my company, whatever it is it. Okay, I just took the drug. I don't know what is it. You don't know what is it as an observer or a doctor. Your patient don't know what is it, right? So three of us, right? Me as an analyzer, you doctor as an observer, and your patients as a subject or group member or participant. All of us don't know about this particular thing what I'm gonna give. Okay, this is called as 1 2 3. This is called as triple blind trial. Understood? Yeah. So observer with that, plus observer plus analyzer, even me, if I'm analyzer, even me, I am also unaware of this thing. So this is called as the triple blind trial. Okay, I hope you're clear with that, guys. I hope you're clear with that. So that's how I can remove the bias. Okay, done, guys. These are your MCQs. Now next point which I'm going to talk about, that is last, guys, that is your confounding factor. So what is the confounding factor? Let's talk about that as well. I hope you guys are enjoying already. So what is confounding factor? Confounding factor, right? Confounding factor. Okay, guys, so let's talk about the confounding factor. Here we are gonna talk about, this is a factor basically which is actually associated with, let me write also, a factor which is associated with, a factor which is this sign I am actually making with for the association with, okay, A slash W. So basically this is associated with both exposure also and the disease also, risk factor also and the disease also, cause also, effect also, right? So basically this factor which is associated with both exposure and disease, exposure and disease, okay, and this is basically distributed unequally in the study and the control groups, okay, in your study group and the control group, this is distributed unequally, okay. That is the definition basically. So associated with both exposure and the disease, okay, and it is unequally distributed I will give you the example, guys, just wait for some moment. Unequally distributed between your study and the control group. Study, by the way, this is the sign of between, right? Study and control group, right? Let me take an example, don't worry, let me take an example. For an example, guys, for an example, right? You're having risk, you're having age of some person that is around 65 years. You're having risk factor in this particular patient that this person is actually a smoker. This person is actually a smoker, that is the risk factor. Now this person is already having the disease. Let's say this person is having the emphysema. Let's say this person is having the emphysema, right? Now what will happen? Look over here. What is the confounding factor? Guys, this is the confounding factor over here. This is the age, right? Now I am saying two things over here. That, age, it is related to the risk factor also, right? How it is related to the risk factor? Because usually the younger person, I would say the 10-year-old child, okay, he will not be the smoker usually, right? Or 15-year-old people, he should not be the smoker usually, okay. So it will be seen in the older age group people smoking, for an example. It could be any risk factor. I just took an hypothetical example, smoker, okay. For example, you might take the example of obesity also. You might take the example of something else also, okay. Obesity can be the risk factor, okay, or something else could be the risk factor as well, or disease can also, you can change actually, okay. Just took the example over here. So smoker, and that's why he developed this disease, that was emphysema. So over here, risk factor. So age, if you talk about over here, right? So age is a common factor to cause the risk factor, and age is a common variable which can cause the risk factor also and which can cause the disease also. So age is a common thing in between. So that's why it is the confounding factor, right? So confounding factor is associated with both, that is exposure also and that is outcome also. Exposure also, disease also. So age is a factor which is related with exposure, that is the smoking. Age is a factor which is related to the outcome, that is disease. Age is related to the smoker also, age is related to the emphysema also. So age is a common factor over here, that's why it is called as the confounding factor. Okay, I hope you are clear with this. So what are the methods which are used to reduce the confounding factor? Methods which can reduce the confounding factor. Okay, if they are asking you this question, then you can easily answer. That is your, I told you what, randomization was the universal answer, right? So randomization you can answer if it is in the option. Or there are two categories, guys. One thing is that either the confounder can be known, so he is a known confounder, either he is known confounder, either he might be the unknown confounder, right? So if he is known confounder, okay, listen to me guys very carefully, okay. So if the confounder is known confounder, right? So in that case, you might take the help of randomization. Either you might take the help of matching. Either you might take the help of restriction. These are the three methods, okay. So they might ask you, and randomization, at least you must remember this, randomization is actually the universal treatment I told you for the bias, either for the confounding, okay, either for the confounding factor, okay. On the other side, guys, again I will write randomization, because this is the universal. So again highlighting the randomization again, guys, okay. Now next point over here, that will be the either the randomization, either regression, either stratification, either standardization, okay. So these are the four methods. How the question might come: which of the following is not the treatment for unknown confounder? So options are there, regression is there, randomization is there, matching is there, and the stratification is there. So your answer will become matching in that case, right? So your answer will become matching in that case, okay. So here we have talked about the non-confounder treatment, unknown confounder treatment. These are the options right in front of you, you should remember them, right? And randomization is the universal, as I have mentioned that before as well, right? And stratification is the most common which is used. Stratification for the unknown confounder, stratification is the most common method which is used for the treatment purpose of confounding factor if it is unknown, guys, right? Okay, now we are going to talk about, we'll try to apply this particular knowledge in some particular MCQs. So guys, first one is systematic distortion. Come on guys, focus over here. So systematic distortion of the retrospective study. First of all, you should answer me, what is retrospective study? Is it cohort, is it case control, or is it cross-sectional study? Yes, it is the case control study, okay. Case control study, very nice guys, case control study. Then second point is systematic distortion of the case control. So here you are seeing the bias options, guys, right? So is it measurement bias? I didn't told you about that, right? Recall bias is also called as, guys, memory bias. Okay, and did I told you that is it under the case control or cohort? Yes, it was under the case control study, guys. Yes, so that's why recall bias is the answer over here. Next question, guys. Hospital patient admission rate differs. Yes, that was studied in what kind of bias? That was studied in Berksonian bias. Okay, that was studied in the which bias? That was seen in the Berksonian bias, right? Yes, so that was the answer, Berksonian bias. Okay, was it studied under the case control bias, or was it studied under the cohort kind of study, right? Is it under the cohort study or is it under the case control study? Yes, you should answer me, guys. That is the hospital based case control study. So this was the example of case control study, or this is the example of retrospective study, or this is an example of interview based study, or this is an example of effect to cause study, right? Okay, very nice, isn't it? Now next question, guys. What is true about double blind trial? I told you about single blind trial, I told you about the double blind trial, I told you about the triple blind trial. I told you that double blind trial is having the high probability coming in your exam, right? Examiners are loving it. Now double blind trial is most commonly used trial, right? In the double blind trial, I told you subject or the group member or the participant is unaware what I'm going to give as an analyzer. You are the observer. So if you are a doctor, for an example, you are also not aware, then in that case this is the double blind trial. If as an analyzer I am also unaware what I am giving, then this is the triple blind analyzer, triple blind study, okay, or triple blind trial, right? So in the first case, patient is not aware, or group member or participants are not aware, or subject is not aware. You as an observer, you are not aware, and if as an analyzer, if I am also unaware or I am also blind, that is called a triple blind test. So in the double blind, you as an observer is blind and your patient, that is your group member or participant, is blind. So that is a double blind trial. So patient getting double treatment? No, patient is not getting double treatment. Okay, I haven't mentioned about that. Second option, patient does not know that he is a part of clinical trial. He knows that he is a part of clinical trial. We'll take the consent of this patient. Okay, so he knows about it. Now patient is getting both placebo and medication. No, either I will give medication, either I will give placebo, but I will not tell what I am giving. Either I am giving placebo, either I am giving medication, but I am not giving both of them. Okay, so be very aware. So A, B, C options have been ruled out clearly. D option is patient does not know what is given. Yes, patient does not know what is given, right? So if I will modify this answer, what is true about double blind trial? Okay, if I am asking triple blind trial, if I am asking single blind trial, D option is suitable for all three questions, because subject or group member or participants are unaware in all the three kind of trials, in a single blind trial also, in the double blind trial also, in the triple blind trial also. So here in the double blind trial, the answer became your D option, which is your patient does not know what is he given, right? So with that, guys, we have ended with the epidemiology playlist. I hope you enjoyed the playlist thoroughly, and in the next section I will be talking about the screening, guys. So stay tuned and I will be seeing you in the next one. Thank you so much.